Hey guys, this is going to be a quick review on how to place your lance when you are gathering capillary blood from a finger puncture. These are the Lancets that you will be most familiar with in lab. Your clinic might have something different. Just whatever Lancet you're using, make sure you know how the blade is oriented inside. If you're having issue with this kind specifically, this is a really great video that I'll put a link to in the description. When you choose a finger, you always want to go for the middle or the ring finger. You don't want to go for the pointer finger because the skin is thicker and it's a little bit harder to get that blood going. The thumb is also thicker and it has a pulse, so there's a higher risk for excessive bleeding. And then pinkies have thinner layers of fat and thinner skin, so you have a higher chance of hitting the bone, which can cause an infection. It will definitely cause pain, and in general is going to cause pain even if you don't hit that bone. When you position the Lancet, you want to make sure you're putting it in the right area. What you don't want to do is put it in the center. This area is too thick. You don't want to put it on the sides either because, just like the pinky, the fat layer and the skin are thinner, and that gives you a higher chance of hitting the bone or just general pain. An easy way to remember what position you should do is just think of the finger as having a little face. Your eyes are going to be where you can put that lance. You can also think of the tip of the finger having a clock on it, and then your puncture sites are going to be right at the tips of the arms at the 2 and the 10. When you are positioning your Lancet, make sure you are going to push that blade in so the blade is running across the ridges of the fingerprint. So if this is the directions of the fingerprint, you want to make sure that the blade is oriented like this, not like this. If you have a cut like this, it's just going to run down those ridges and create a big mess. And it also is not going to give you that drop that you want. Instead, you're just going to have sort of a shallow puddle, and it's going to be really hard to get a sample that does not include skin cells. Instead, you want your cut to look more like this, because then you will build up that nice big drop. And I'll show you what that looks like over here a little bit more. So here's our finger ridges. If we cut like this, it's going to run down the finger like that, and you'll have kind of a shallow, long puddle. Instead, you want to cut perpendicularly, and then you will form this really nice little blood drop that will be much easier to approach with your capillary tube, like that, instead of aiming closer to the skin. Some final reminders: when you're gathering the blood, do not just squeeze the tip of the finger. That's going to cause tissue damage, and the cellular debris will get into your sample, and that will affect your tests. You can squeeze the finger in this direction, but it should be light squeezes, and you want to do continuous little squeezes all the way down the tip. Don't like push here, and then push here, and then push here. It should be little tiny pushes coming down. If your patient is not bleeding enough, the first thing you should do is try to wipe away any clots that are forming at the site. Also, use a warm compress. Try to know at the beginning if your patient has cold hands, so you can have that warm compress on hand if needed. Another thing you can do is have the hand in a lower position. I like to have the patient in a chair that is higher than mine, and then have them put their hand on their knee, because that will put the hands below heart level, and they're comfortable and I'm comfortable. Alright, well, let me know if you have any questions, comments, or corrections, and I'll see you in class.